So the ENZAMET study is somewhat similar to the TITAN study, and it's evaluating the same concept of adding a next-generation AR inhibitor, that is enzalutamide with ADT versus ADT alone, or standard of care ADT. It's a little bit different than the TITAN study, as the ENZAMET study was not blinded. There was no placebo control, and as well, in the TITAN study, patients were allowed to have prior docetaxel before going on to the study. And the ENZAMET trial, if patients were to have docetaxel, they had to have docetaxel on the trial. So they were receiving docetaxel with enzalutamide. So there's a little bit of differences between the two trial designs. There was, again, benefit in terms of overall survival, which is the primary endpoint of the ENZAMET study at the first interim analysis. There's also benefits for progression. Now, a key question where both these trials, TITAN and ENZAMET, is whether patients should get docetaxel with an AR pathway inhibitor. Now, these were not the direct questions. This was not being questioned. This was not the primary question of these studies, whether patients should receive the triplet of ADT, docetaxel, and apalutamide or enzalutamide. However, both studies do show, at least the TITAN study shows, that in the patients that received docetaxel followed by apalutamide, there was a benefit that was consistent with the overall results in terms of radiographic progression-free survival. So the question is unanswered. However, there is some data that suggests for certain patients we could consider the use of apalutamide after docetaxel.